Okay, we are now ready to go over all the common upper GI dysfunctions. So I'm going to start with hypochlorhydria. This is low stomach acid. I think I just butchered that word, but this is where you don't produce enough stomach acid. And then you can have symptoms like indigestion, bloating, gas, and heartburn. And you feel full after, or you have a lot of burping or belching. Those are all signs that you do not produce enough stomach acid. Now, when this happens, the biggest thing is you're going to have problem with digesting your nutrients, and the food that sits in your stomach, they start to ferment, and then they start to produce gas in the stomach, starting to irritate the lining of the stomach, and it can cause damage to the stomach lining. So the cause or the consequences of this is you're not going to be able to break down protein. And I shared with you, protein is really important because these are the building blocks that you need to make protein in your body, to make hormones and neurotransmitters, right? And your immune function needs protein as well. And then the undigested food can go down further into the digestive system and cause food sensitivities or food intolerances. And they can also disrupt the signaling of the pancreas and the gallbladder to release enzymes and bile release. This is because if you have a lot of stomach acid, once it goes into the small intestine, it'll trigger the gallbladder to release bile. This is how our body neutralizes the acid in the stomach. So if your body is not producing a lot of stomach acid, it will tell the gallbladder, like, you can't produce that much bile. I don't need a lot of neutralization. So now your gallbladder doesn't produce or release bile. What ends up happening is then your gallbladder can develop sluggish bile release, and then and bile, keep in mind, also has toxins and cholesterol in them, and this is how you form gallstones. Gallstones are produced when the gallbladder doesn't release bile when it's supposed to. And then altered the pH environment, allowing harmful bacteria to grow and thrive in the small intestine, also the stomach as well. So one bacteria that can infect the stomach is H. pylori. This is actually one of the causes, which I'm going to go over here. So H. pylori infection can cause you, basically as a protection mechanism, it shuts down stomach acid production so that it can stay alive in the stomach. And this is actually really common in Asia, not very common in the US. You're going to see them, but it's not that prevalent here. But it is one of those root causes that you need to know and treat properly in order for your gut to return to normal function. Stress can also cause low stomach acid production. It's just a response to the stress. When you're under a lot of stress, you shouldn't really be eating because your body doesn't produce stomach acid when you're under stress because your sympathetic system is active. And I shared with you, parasympathetic system is what controls the digestive function. So if you're not in a parasympathetic state, you cannot digest food that you consume because stomach acid isn't produced. And then if you eat on the go, not chewing, right, eating really fast, or eating when you're upset or arguing with someone, don't eat, just skip that meal. It's not worth it, right? And then aging, again, not so much, aging is not the cause, but aging is a byproduct of a high toxic burden, because as you age, you're going to collect more toxins, and these toxic burden is going to interfere with function in the gut, but also overall function as well. Chronic use of antacids or proton pump inhibitors pretty much will shut down your acid production, because in conventional medicine, the belief is if you have reflux, you have too much stomach acid, so then you're given these medication that then shuts down your stomach acid production. But that's actually is a misconception, miseducation. We don't have reflux because of high stomach acid. It's actually due to low stomach acid, but we're going to cover that in a little bit more. And then you can also have zinc, magnesium, and sodium deficiency can lead to the lack of production of stomach acid, because you need these nutrients for those cells in the stomach to produce stomach acid. Parietal cells, those gastrin cells, they need nutrients to be able to work. A low protein diet, again, contributing to just the overall function. Dehydration, we don't function well when we're dehydrated, just period, because we're at 70% water. Our cells need water to get the signal. Like our communication from the brain to the gut requires water to transfer communication. And then when you don't have enough water, the cells just don't get the communication properly. So the biggest thing that you could do in low stomach acid is really lifestyle. Improve your meal hygiene, you manage your stress, hydrate. And if it's really severe, you can take digestive enzymes like betaine HCl, digestive bitters, bitter melon tea. Those things stimulate your digestion as well. However, you don't want to manage them long-term with these, because you will then permanently almost shut down the production of stomach acid if you only use digestive enzyme replacement. All right, so acid reflux, or GERD, gastroesophageal reflux disease. So there's a lot of people that deal with this, and this is where your acid reflux back into your esophagus and sometimes up into your throat and mouth, causing heartburn, regurgitation, chest pain, difficulty swallowing, sore throat, chronic cough, and hoarseness. And the consequences is that you can have esophagitis, inflammation of your esophagus, leading to ulcers, strictures, and Barrett's esophagus, which is a precancerous condition due to chronic regurging of your acid. Throat and oral tissue damage, leading to, again, chronic sore throat, erosion of your tooth canal, your tooth enamel, and other oral health issues, right? So, and the root cause is low stomach acid, not high stomach acid. So you don't need PPI or antacid medication. You need to actually add more acid, which is hydrochloric acid or betaine HCl, right? Hiatal hernia can also cause acid reflux, but it's not a main cause. When you have a hiatal hernia, some people don't have, issues, but the people who have issues is because they have bloating, and that gas in the small intestine can push the stomach upward, and then causing the acid to reflux back into your esophagus. And then pregnancy, again, pressure from having the baby, obesity, again, pressure, right? So you're seeing here is an anatomical problem. Chronic stress can also cause it. Overeating, right? Because you can't process all the food, it's going to regurge back. And then certain food is known to be a triggering of the symptoms, but they're not the root cause, right? Spicy, fatty and acidic food, and delayed gastric emptying. This is where you don't have bowel movements regularly. Things are backing up. So if you're chronically constipated, this will also regurge back up as well. So lifestyle, in general, you avoid food triggers, you elevate the head of the bed, manage stress, maintain healthy weight, but those are not really going to address, they can relieve a lot of the symptoms if that is your root cause, but sometimes you have to treat the root cause of low stomach acid, and that's going to come down to possibility of H. pylori infection and other infection. And then supplements, you could use MegaGuard, Cetizyme, betaine HCl, DGL, aloe vera, and slippery M. They don't improve the symptoms, but they will help you heal the inflammation that is going on in the esophagus and the stomach. So you got to know when to use these properly. And then hiatal hernia is a condition where the part of the stomach protrudes through the diaphragm into the chest cavity. Like I said, some people have symptoms, some people don't. Most of the time it's an incidental finding where they have some kind of imaging done and they're like, oh, you have a hiatal hernia. And the symptoms you would get is heartburn, regurgitation, chest pain. So again, not all hiatal hernia will produce these symptoms. Only when you have other symptoms like GERD, esophagus issues, and other digestive system symptoms or problems where you're just not moving the food along, that's when you start to have symptoms. So abdominal pressure due to obesity, pregnancy, or heavy lifting can cause the protrusion of the stomach, and weakened diaphragm from asthma, lung fibrosis, or age-related changes, and trauma or injury. And the treatment is eating smaller meals, more frequent meals, and avoid lying down after meals so that you can digest your food before you sit down or lay down, and maintaining healthy weight so that you don't have all of that abdominal pressure. And then you avoid triggering food, reduce fiber if fiber worsen your symptoms. That can happen. All right, so gastritis and ulcers. This is when you have this inflammation of in the stomach lining. And then ulcers is when sores or lesions develop in these linings. So it's not just a superficial inflammation anymore. This is now going into deeper layer of your tissue, and they're painful. So this usually is the result of the erosion of the mucosal barrier, and potentially cause bleeding and perforation. Now, those are like really serious complications. And then you can have increased infection risk. And then this whole ulcers and inflammation create a favorable environment for H. pylori to grow. And then when they can overgrow, other organisms can start to cause a problem as well. Now, H. pylori overgrowth is the biggest cause of peptic ulcer disease or ulceration. Chronic use of NSAIDs, right? Excessive alcohol consumption, stress. I would say chronic stress, not just stress. Smoking is a big factor, poor meal hygiene, and highly processed food. Those are all contributing factors. I don't think, especially with what I have observed and learned, is that not one, like the infection is on its own can cause a lot of issues. But when it comes to lifestyle, it's the combination of different unhealthy lifestyle that contribute to the development of ulcers. So in general, avoid NSAIDs. But if you're dealing with chronic pain, you're dealing with gut issues, because all of that inflammation, that pain is coming from your gut. Just don't cover it up with NSAID medication, treat the root cause. Alcohol, smoking, managing stress, avoid overeating. But again, those are not the real reason why you develop these, okay? Avoid irritating foods. It's only going to manage symptoms. And supplements you could use, again, MegaGuard. PyloGuard is this really cool probiotic that is developed by Microbiome Labs. I really love this product because they actually, they're only probiotic in a capsule. You break it up, you drink it. And these bacteria will go into the stomach and bind to all the H. pylori. It doesn't do anything else. It doesn't bind to anything else. And it will pull all of the H. pylori out of your stomach. What's really interesting is that when people are on this, their stool smells so bad because they're pulling out so much H. pylori. And a couple of months later, their H. pylori is improved. Now, conventional treatment of H. pylori is 4 antibiotics or more, treated for a month, sometimes more, multiple times, and they're still symptomatic. This is where conventional medicine is failing at treating gut diseases, because we're just targeting the wrong thing, and just medications, they just don't work, okay? And zinc, carnosine, DGL, aloe vera, they don't treat the symptoms. Again, they can soothe the inflammation, maybe improve some of the symptoms a little bit, but they do not treat the root cause. Now, bile insufficiency, gallstone, and gallbladder removal. These are all things that you need to know about, because a lot of women in their 40s who are overweight after pregnancy are going to have gallbladder issues. So bile insufficiency is when inadequate bile production or flow from the liver or the gallbladder. So you just don't release the gallbladder properly, or when the liver is not producing bile properly, this is when you're going to have bile insufficiency. And then gallstones is hardened deposits that form in the gallbladder from cholesterol being concentrated in the gallbladder because they're not being released properly. And then gallbladder removal. So those of you who have had your gallbladder removed, you basically just can't concentrate the bile. So you're going to have problem with digesting fat. Some of us, or some people, they're not going to have issues after gallbladder removal, but a lot of people will have chronic diarrhea, malabsorption, bone loss, because you can't absorb a lot of nutrients from not having a gallbladder. And not to mention, you can't really detox properly. So the signs and symptoms is usually bloating, floating or greasy stools, because you're not absorbing fat, poor fat absorption, leading to vitamin A, D, E, and K deficiencies, constipation or loose stools, depending on what you have, and hormone imbalances. So this also affects it as well. And then you can also have physical pain, especially in the upper right abdomen. You can have nausea after you eat, especially a fatty meal. And you can also have pain that radiate to the back. That is very classic of gallbladder dysfunction. And then if you have removed a gallbladder, again, loose stools, urgency after eating. So you pretty much have to run to the restroom, and then reduce fat digestion. Consequences, right? Nutrient deficiency, also risk for SIBO, small intestinal bacterial overgrowth, because you don't have bile that pretty much kill off the bacteria that are growing in the small intestine, and then risk of gallstone formation and inflammation due to sluggish bile flow. And then the root causes is chronically consuming highly processed fatty food. So fast food, French fries, like all the burgers and all the nuggets and chicken strips that we consume, right? And then not having fiber. So you consume those, but if you eat a lot of fiber, you can manage some of it. That's why some people don't have the problem. And chronic dehydration, liver congestion. So when you have a high toxic burden, you're going to have a lot of issues with the gallbladder. This is, again, coming back to that toxic burden idea, or that factor that's going to really affect the liver and the gallbladder. Toxic overload, low bile acid recycling. So our body recycle it because we absorb the bile back, send it back to the liver, and then if that process doesn't happen, then you're not recycling bile, nutrient deficiency, dysbiosis, and sedentary lifestyle. Gallstones can form when you have too much estrogen as well. This is why post-pregnancy, women in our 40s, we have a lot of hormonal imbalances. And most of the women now, especially if you've been on birth control or you've been exposed to endocrine disruptors from the environment, like pesticide, insecticide, and then you have a genetic predisposition, you're going to have issues with clearing the bile, and then the bile becomes sluggish, and then you form stones. Rapid weight loss can also cause this sluggish, low bile flow and poor bile acid recycling. So the treatment for this is really chew your food, relax, eat, take out the time to eat smaller meals and more frequent meals. All of these will help with one point or another, but if you do all these things and you still have symptoms, this is where you need to treat hidden infection. This is what I do when patients come to me. Most of them, they've done everything and they can't control their symptoms. And that's when you really want to look at, are there other things out there that is obstructing the bile ducts? Because these are ductal system. You see the gallbladder, they release their bile through this small, tiny little tube. Well, if you have parasites that's blocking these tubes, or the opening to these tubes, guess what? You can't get bile down there. Okay, and there are some supplements that you could use. Bitters are really good for gallbladder. So any food that tastes bitter, digestive bitters. A product I love is Bitter X, has all the bitters in there. It tastes pretty good. MegaGuard, CTzyme, Tutka, ox bile. So for people who have had their gallbladder removed, you need to replace you need to supplement with some kind of fat emulsifier, either ox bile or digestive bitters. Find whatever works for you, but that you're going to need that to get your nutrients in. And that is it. We're going to go into common lower GI dysfunction in the next video. Thank you.